Space of almost 6 decades, life expectancy in the United States increased by nearly 10 years, according to a study published in the Journal of the American Medical Association. By 2014, the average American lived until they were nearly 79 years old. But the study, Life Expectancy and Mortality Rates in the United States, says life expectancy is now gradually falling. And experts say it's because more people are dying in middle age, and specifically between the ages of 25 and 64. The US now has one of the worst midlife mortality rates among high-income countries, even though it's the global leader in per capita spending on healthcare.
I think I know exactly what's going on. The opioid epidemic in the U.S. is ravaging our younger population, and it is really making a dent in life expectancy. You know, you go to certain parts of the United States, the primary source of organs for transplant is young people who overdose. And that never was true in the United States until 5, 7, 10 years ago.
By comparison, in Japan, life expectancy is 84 years old. In the United Kingdom, nearly 82. But in the US, it's now 78.6 years old. And middle-aged death rates are highest in areas of economic decline. Researchers say major causes of death amongst those aged 25 to 64 resulted from drug overdoses or alcoholism, suicides and organ diseases. And the US economy could be affected if death rates continue to rise among middle-aged adults.
These are prime working ages, and so there's the foregone output, foregone productivity of somebody who dies prematurely. The U.S. Council of Economic Advisors about 2 years ago came up with an estimate that somewhere a little bit less than 3% of GDP could be the measurement for the lost employment, the extra medical and other costs, and the cost of the premature deaths.
There is no agreed solution, but health experts say the country does need better public health campaigns.
We have to shift our focus in our healthcare system more from just treatment. And, you know, even though not everybody has easy access to the U.S. system, if you get into it, it's great. But prevention, we stink. We're terrible. We don't have outreach. We don't have good health education in our schools. We're not working with the food industry to try to combat obesity in a serious fashion. We've got to change that ratio.
Even if Americans were to reverse their recent backward trend, one estimate says that at its rate of longevity growth from the past several years, it would take the U.S. more than 100 years to catch up with the average life expectancy other wealthy countries reached by 2016. Sarah Walton, CGTN, New York.